Hello and welcome everyone. I am Amar and the founder of Forensic MCQ.com. And in this video, I'm going to present 10 important questions on mercury poisoning. And it is the part 7 of the series of Forensic Toxicology MCQ. So without any further delay, let's move to the question number 1. Question number 1 state that which is the most toxic mercury compound? And here are the options. First is metallic mercury. Second is inorganic salt of mercury. And third is organic salt of mercury. And fourth is none of the above. So before answering the question, let's talk each of the options. So first is metallic mercury. So metallic mercury is not poisonous. So it is not poisonous when swallowed. Swallowed. So when someone swallowed metallic mercury, then it is not poisonous because it is not absorbed by GI, means gastrointestinal tract. So it is not absorbed by GIT. But in the case when the metallic mercury is get converted into vapors, then it can easily absorb by the body or the lungs, and in that case it became highly toxic. So metallic mercury is not the correct answer. Moving to the option second, inorganic salt of mercury, they are also not as toxic as organic one. So the third option, that is organic salt of mercury, is the most toxic form of mercury, and basically it has two main types of mercury compound. First is methyl mercury, and second one is the dimethyl mercury. So in all the compound, methyl mercury is the highest toxicity or the most toxic compound of mercury. So the correct answer for this is option 3, that is organic form of mercury, that is organic salt of mercury. That is option 3. Now let's move to the question number 2. So question number 2 is the match the following question, and in this first is the form of mercury and second describes its description. So moving to the option first, that is mercury iodide. So mercury iodide has a big red color. So it has big red color, and it is majorly used in making cathode of the mercury cells. So option third of the description, used as cathode for mercury batteries, is the correct match for option A. So option third is the correct one. Moving to the B part, B says mercury thiocyanate, and mercury thiocyanate is also known as pharaoh serpent, and it is an Egyptian origin word, and serpent means snake. So it is majorly used for making crackers that produce a winding snake-like offset when they are set on fire. So option first, that is known for producing a snake when set on fire, is the correct match for the option B. So for B, first is the first is the correct answer. Moving to the C part, that is mercury sulfide, and mercury sulfide has a red color, and it is most commonly known as sindoor or vermilion. So option 4, that is red pigment including vermilion, is the correct match for the mercury sulfide. That is option number 4. Moving to the D part, that is mercuric iodide, and mercuric iodide is also known as prot iodide. That is prot iodide, and it has red or orange color and majorly used to treat syphilis. So it is used for treat syphilis. So the correct match will be the second for mercuric iodide. Apart from mercuric iodide, there is another compound known as mercuric chloride, which is also used to treat syphilis. It is also used to treat syphilis, but they are more toxic than mercuric iodide because they are more soluble in water and also have white crystalline structure, white crystal structure. So moving to the questions again, the correct answer for this question will be the option 3, option 1, followed by option 4, then option second. Now let's check the options. That is option third, first, fourth, and second. That is option number 4 will be the correct answer. Now let's move to the question number 3. Question number 3 says, how do mercuric salt compare to the mercurous salt in terms of toxicity? So in mercuric salt, the mercury has divalent structure. So in mercuric salt, for example, HgCl2, that is mercuric chloride. So in this, the mercury has 2 plus power, or it has divalent form. But in case of mercurous salt, for example, mercurous chloride, Hg2Cl2. So in this case, the mercury has a monovalent form, that is Hg plus. So this Hg2 plus or divalent form of mercury is more soluble in water. So it is more soluble in water, and the divalent form of mercury has more affinity towards the SH group, that is sulfihydryl group, which enhances the toxicity of the mercuric compound. So the correct answer will be the mercuric salt, that is Hg2 plus, has higher toxicity than Hg plus. Now let's check the options. First is mercuric salt are less poisonous than mercurous salt. It is wrong. Moving to the option second, mercuric salt are more poisonous than mercurous salt, and it is correct because it correctly says mercuric chloride or mercuric salt is more poisonous than mercurous salt. So this statement is correct. So option second is the correct answer for this question. Now let's move to the question number 4. So question number 4 says, how is mercury absorbed into the human body? So before checking the options, let's evaluate how mercury is absorbed in the human body. So let's say, as you know, as he already stated in first question, that the mercury has three main forms. First is elemental mercury, and second is inorganic, and third is organic. So in case of elemental, it is usually not absorbed in GIT when swallowed. When a person swallow elemental Hg, then it will not absorb by GIT. But in case when a person absorbs or inhale the vapors, so in case when he inhale the vapors, in that case, then the absorption rate by the GIT or the lungs is about 80%. Is about 80%. And in case of inorganic Hg, they absorb about 10% in GIT. So it is only absorbed 10% in GIT. But in case when the inorganic salts are applied towards the skin, let's say when they are applied to the skin, then they can easily penetrate through the skin and the mucous membrane. Lastly, in case of organic mercury, it can be divided into two parts. First is long chain of alkyl Hg mercury, or short chain of alkyl Hg. So in case of long chain, as they are long in structure, then the absorption rate is usually lower as compared to the short chain. Means short chain has higher absorption rate in GIT, but the absorption rate in case of long chain is about 50% or more in GIT, and in case of short chain alkyl Hg, then the absorption rate is more than 90%. So you can easily see that the methyl or the organic form of Hg, so it because it has higher absorption rate even than the vapors of elemental Hg. So now I hope you get the idea about how the mercury absorbed in the body. Now let's check the options. So option first says elemental Hg is not absorbed through GIT. So this is the correct statement. Moving to the B part, elemental Hg has 80% absorption rate upon inhalation. I already told you it has when the mercury Hg is absorbed through vapors, then it has an absorption rate of 80% or more. So B option is also correct. Moving to the C part, long chain of alkyl organic Hg is absorbed more than 80% through the GIT. As I already told you, it is about 50%. So option C is wrong. Moving to the D part, that is short chain alkyl organic Hg is absorbed more than 90% through GIT. And I already told you that the short chain of GIT has more than 90% absorption rate of organic Hg. So it is the correct answer. So option D is also correct. So for this, option A, option B, and option D is the correct answer. Now let's check the options. So option A, B, and D, that is option number 3, is the correct answer. Now, let's move to the question number 5. Question number 5 says, how is organic mercury primarily excreted from the body? And here are the options: through sweat, through urine, through feces, and exclusively through hair growth. And the correct answer for this question is option 3, through feces. So in case of organic mercury or in case of organic Fg, so it is primarily excreted from the feces or fecal matter. But in case of inorganic or metallic, or you can say elemental, then in both the cases, then they are excreted either by the urine or fecal matter or feces. So you can say that organic mercury usually or majorly excreted through fecal matter, and in case of inorganic or elementary mercury, then it usually excreted via urine or feces, both. So the correct answer for this question is option 3, through feces. Now let's move to the question number 6. Question number 6 says that what is the concentration ratio of methyl mercury in hair as compared to whole blood? So question wants to ask what is the ratio of methyl mercury in hair when compared with the whole blood. And here are the options. Option first says 50 times more in hair. Option second says 100 times more in hair. Option third says 250 times more in hair. And option four says 500 times more in hair. And the correct answer is option 3, 250 times more in hair. Now let's discuss why methyl mercury has higher concentration in hair, that is about 250 times more than blood. So why it is this? It is majorly because of the structure of hair. As you know, I already told you in previous slides that methyl mercury has higher affinity towards the sulfur hydryl, that is SH group. So it has higher affinity towards the SH group. And as you know, the hair is made up of keratin, and keratin is rich in cysteine, and cysteine has a SH group. That's the reason why the methyl mercury concentration is more in hair as compared to blood. Now, let's talk some stats about mercury in blood. So, stats 1 states that methyl mercury, that is methyl mercury, has more concentration on RBC. So, it has more concentration on RBC than plasma. And the ratio is around 10:1. And this is again due to the higher affinity towards the RBC because it has hemoglobin and it also has SH group. Moving to the stat second, that is in inorganic salts of Hg in blood, the ratio is usually 1:1, and it is majorly again due to the lower affinity of inorganic salts towards the SH group. So there are three main pointers related to the methyl mercury and their ratio in hair and blood. First is the hair has 250 times more concentration than blood. And second stat is in case of methyl mercury, the RBC usually have 10x more methyl mercury as compared to plasma. Moving to the stats 3, and in case of inorganic mercury poisoning, the concentration of mercury on RBC and on plasma is usually same. So the correct answer for this question, that is the concentration of methyl mercury in hair compared to whole blood, is option 3, that is 250 times more in hair. Now let's move to the question number 7. Question number 7 states that what are the mercurial tremors, also known as? And here are the options. First is the Parkinson's tremors, second is Danbury tremors, third is Walker tremors, and fourth is cardiac tremors. And the correct answer for this question is option second, Danbury tremors. Apart from Danbury tremors, there are two other names of mercury tremors. That is, first is glass blower tremors, and second is Hatter's tremors. So these are the three names of mercurial tremors. First is Danbury tremor, second is glassblower, and third is Hatter's tremors. Apart from this, there are two main types of tremors in case of mercurial tremor, and you can categorize mercurial tremors. So mercurial tremors can be categorized into two forms. First is the static or resting tremors, and the second one is intentional tremors. intentional tremors. So in case of static tremors, they usually occurs when the muscles in rest. When the muscles is in rest. And it is mostly seen in upper extremities, for example, in hands. It is usually seen in hands and fingers. Moving to the second type of mercurial tremor, that is intentional tremor. They are usually occurs due to the two reasons. First is purposeful movement of extremity, for example, hands and feet. In that case, they occurs, or when the static tremors become intense. So intentional tremors are occurs when a person purposefully move their hands or feet, or the static tremors become worse or intense. Then in that case, they occurs. Now let's check the explanation part. So mercurial tremor was first described by the J. Addison Freeman in 1860. He published an article in the Transaction of the Medical Society of New Jersey entitled "With the Mercurial Disease Among Hatters." Now, let's move to the question number 8. Question number 8 says, what does the concussion mercurialis refers to? And here are the options. The initial onset of the mercury poisoning symptoms. Option second, a mild headache caused by the mercury exposure. Option third, the last stage of mercurial tremors where daily activities are hindered. And option four, a rare form of skin rash associated with mercury poisoning. And the correct answer for this question is option three, the last stage of mercurial tremors where the daily activities are hindered. So, concussion mercurialis refers to the last stage of mercury tremor where the tremors are so intense that they prevent the individual from performing their daily activities. So the correct answer for this question is option three, the stage of mercurial tremor where the daily activities are hindered. Now let's move to the question number 9. Question number 9 says, what frictional work is refers to describe the neuropsychiatric effect of mercury poisoning? And here are the options. Option first says The Adventure of Tom by Mark Twain. Option second, Alice Adventure in Wonderland by Lewis Carroll. Option third, A Study of Scarlet by Arthur Conan Doyle. And option four, The Sign of Four by Arthur Conan Doyle. And as you already know, The Study of Scarlet and The Sign of Four is the book that featured Sherlock Holmes, and it was the first book that is The Study of Scarlet that featured Sherlock Holmes, and it was authored by Arthur Conan Doyle. But it doesn't describe the neuropsychiatric effect of mercury as in a fiction book, and it was described in the Alice Adventure in Wonderland by Lewis Carroll. So the option second is the correct answer. Now let's check the explanation part. The Mad Hatter are characters in the Alice Adventure in Wonderland. So there is a character that is known as the Mad Hatter, and it was described or featured in the book that is or novel that is Alice Adventure in Wonderland, and it is associated with showing the sign of mercurial erythism. So mercurial erythism is a type of chronic mercury poisoning, and it is also known as Mad Hatter disease. Apart from that, the symptoms of mercurial erythism are the tremors, emotional instability, irritability, aggressiveness, anxiety, and memory problem, and even the manic depression psychosis. And this manic depression psychosis gives the name to this disease, that is the Mad Hatter disease. So this Mad Hatter disease describes the condition or the symptoms of the hat workers. So these describes the condition of hat workers that are working in 18th or 19th century for making hats and exposed to the mercury vapors, and which majorly leads to the accumulation of mercury in their body over time. So they are exposed to the mercury in a chronic form. So it is a type of chronic mercury poisoning, and all the tremors, for example, that we discussed in the previous slide, that is Denbury tremors, Manhattan's or Glassnode tremors, and all the tremors are the example of chronic mercury poisoning. Now, let's move to the question number 10. Question number 10 says, what causes Hunter-Russell syndrome? And Hunter-Russell syndrome is also known as Minamata syndrome or Minamata disease. And this Minamata name comes from a region in Japan or a bay that is known as Minamata Bay in Japan, and it is one of the most disastrous epidemic. and it is due to the exposure of inorganic mercury, and it was released by a chemical factory known as Chiso Corporation. So the Chiso Corporation dumped their chemical waste in nearby waterlands. So what that happened with the time that this inorganic mercury gets converted into methyl mercury by bacteria. So bacteria feed it on inorganic mercury and get converted into methyl mercury, which is again consumed by the fishes and shellfishes, and which again consumed by the locals, that causes chronic symptoms of mercury, which includes tremors, CNS depression, and many more. Now let's check the option. So option first says acute exposure to methyl mercury. So what does the acute exposure means? Acute exposure means several doses in short period of time. Short period of time means several doses in short period of time. So it defines acute exposure. But in case of Minamata Bay, the locals were eating fishes and shellfishes for over a period of time or a long period of time. So it can't be acute exposure. Moving to the second, chronic exposure. So what is chronic exposure? So chronic exposure is small doses over long period of time. Long period of time. So several doses or small doses for long period of time, and it is what that happens in the Minamata Bay, and it is also due to the methyl mercury. So the correct answer for this question is option second, that is chronic exposure to the methyl mercury. Now let's check the explanation part. So explanation says symptoms primarily affect the CNS tremors, followed by visual blurring and tunnel vision and weakness. And these are the main symptoms related to the Hunter-Russell syndrome. And in case when these fishes were eaten by the pregnant woman, then it causes congenital Minamata disease, in which the infants born with some disabilities and deformities. So this not only affects the current generation, but also to the future generations that were living in the Minamata Bay of Japan. With that, this video is ended, and I hope you like our content, and I hope you have subscribed our channel. And if you haven't subscribed, please subscribe, and I will meet you in the new video. For then, take care of yourself. Thank you.